seems like it's there, but if you don't do this right, you're stuck with the bill, buddy. Pull the rug from under your feet.
Susan Yeager had developed the Tribal Vet Program, and which is now called the Rural Health Program. And it was a godsend to Southeast Alaska, because before, pretty much the care, if it wasn't able to be done in the community, most people thought, or were under the impression, that they'd have to go all the way to Anchorage. For an elderly person or somebody that's hurt, flying that flight, the milk run, is not a pleasant thing. It would take about 3 days.
You'll get up at old dark 30. Weather permitting, you'll make your early morning flight to Ketchikan to land at the airport. It's all time and distance. If you miss the connection, you missed your appointment in Anchorage.
So we could work with the integrated care office. I got to know the numbers, the fax numbers, and the people in the integrated care. And a lot of times the Southeast Alaska veteran could fly down to Seattle to another VA. So it actually saved the VA money because the flight would be cheaper. It would also be an hour and a half, which beats the heck out of an all-day flight up to Anchorage. When the Veterans Choice Program came in, and this is my opinion, that they have put an extra added layer of bureaucracy. So now you're educating people that are in the lower 48 that have no idea about the limitations on geography, that we can't just get in the car and drive to the next VA place, that we have to schedule a flight, either ferry or airplane, to Ketchikan and then catch something to go somewhere else or be seen in Ketchikan. For the state of Alaska, in my humble opinion, I think that we should not have the Veterans Choice. I think going back, it's not that I'm an old dog and I can't learn a new trick. Alaska was working well. We had a health director, Susan Yeager, that had reached out to the communities and got the people into the VA system, got volunteers like myself to understand the departments in the VA, like the integrated care department. And they're vital. They get all things done. They have social workers that can get a flight if a veteran can't afford it. They can get you to an oncology unit in Seattle if you need it. They can get you to a retinal specialist in Anchorage. It was working. We had gotten everything solved so that we went to Seattle or Anchorage, which was ever better for the veteran and the VA, wherever they got the better care. And now we've got everyone just doing another step to go through Veterans Choice to get the same thing. And Veterans Choice does not do travel. VA does travel. So if the veteran's entitled to travel, they're going to get through the VA. They're not going to get diddly squat from Veterans Choice on travel. So for here, I mean, unless it's done locally at the Peace Health Clinic or the Native Clinic, it's doing nothing as far as travel goes.
Do I feel forgotten? I feel that Alaska has been forgotten. I think that this old system was better, especially for Alaska. I don't know what they're doing down there. I keep hearing it's getting better, but it sure as hell isn't getting better here.
Is my decision to move, to relocate to more accessible veterans care versus choice? Yes. Yeah. This is part of the move. You got to do something. Things are a little more positive. It's just a bigger medical base down there, and maybe I'll get the answers I'm seeking. Here it's you call and you wait, and then eventually somebody gets back to you.